Welcome to Ask Sid, the official podcast for Sydenham Clinic, a clinic where luxury meets medicine. We are on a quest for longevity. And I am so thrilled to be your host on this show. My name is Anchal Bhatia. I am the founder and CEO of Sydenham Clinic and the author of Your Doctor is Not God and How to Be the CEO of Your Health. I look forward to taking this journey with all of you and having amazing thought leaders, guests, and members of our Sydenham team answering questions that you put forward. And I urge you, and I hope you will, ask Sid more questions on longevity, wellness, living to your highest potential. We are all trying to be the best versions of ourselves. And our physical, emotional, and mental health is foundational for us to achieve health and success in other realms of our life. So welcome to Ask Sid.
Hi and welcome. I'm Shana Tatum, registered dietitian here at Sydenham Clinic. And I'm so happy to be here with you today to talk a little bit about the microbiome. You've probably heard lots of things about the microbiome in the news, on social media, who knows where else, maybe your aunt. But the microbiome has so many good, important effects for our health. So today we're going to talk a little bit more about them. So we have several different microbiomes. We have one on our skin. We have our gut microbiome, which is mostly going to be what we're going to talk about today. We have a microbiome in our respiratory tract. And women, we even have a vaginal microbiome. So all these different areas have different bacteria, different yeasts, different fungi. All these microbes have a mostly positive effect on our health, but sometimes can also be a negative effect. So today we're going to talk a little bit more about these different microbiomes, particularly the gut, and what it will do for our immunity, a little bit of our neurologic health, and our metabolic health. It's interesting to know that there are about 100 trillion different microbes from the mouth to the anus. And we know that humans have about 23,000 genes, but did you know that the entire microbiome in the body is about 300 million genes? So you could say that we're more bacterial DNA than we are human DNA. And what does that really mean? It sounds kind of weird, but it's something that has an impact on our health. So when we think about these microbes, we want to better understand the benefits that they have. So to understand some of the benefits, let's first think about where do they come from? So we used to think that babies in the womb were in a very sterile environment. Now we're finding out that it's not as sterile as we thought, and there may be some early signs of bacteria present there. We know when the baby comes through the vaginal canal, it's seeded with microbes. And so one of the things that we're concerned about with babies that are born by C-section is they may be missing some of that initial seeding. Thankfully now, many obstetricians are starting to swab babies with some of mom's microbiome bacteria so that they get that initial seeding and start to grow that ecology the same as a child that was not born by C-section. Another benefit is when a baby is breastfed. There is some movement of bacteria through the breast milk, but also just that skin-to-skin contact that a child has with mother, or different if a baby is not breastfed and fed by bottle. There's a different type of microbiome that can be established. So it's actually one of the questions we ask in our intake is understanding, was the patient born term or was it a preterm birth? Was it by vaginal delivery or C-section? And was breastfeeding part of that early exposure? Because all of these things can give us a little clue to if that microbiome had an early, good, positive start and how it was shaped. So there are three really interesting areas where the microbiome can affect our health. First is with our metabolic health. These microbes make interesting byproducts, all the way from vitamins and like vitamin K and vitamin B12 to byproducts called short-chain fatty acids. These short-chain fatty acids have many effects on our health. They are energy that's produced that can power some of the cells within the intestinal tract, but it also affects our cells like liver cells, kidney cells, and heart cells. We know that these short-chain fatty acids can also travel past the blood-brain barrier into the brain and have an effect on the brain as well. When it comes to other neurologic functions, these microbes can help regulate our neurotransmitters. So neurotransmitters like serotonin and dopamine, we all want a lot of that. You know, serotonin is the neurotransmitter that gives us that real good sense of well-being. And dopamine is one of the neurotransmitters that helps us feel motivated and feel excited that we've received a reward in a sense. We also have GABA, which is one of my favorite neurotransmitters. It's a calming neurotransmitter. So these effects that the microbes can have, they actually start to regulate some of the function of those neurotransmitters. So when we think about neurologic health and our microbiome, we really want to be sure that we have a good, healthy microbiome and we're doing things to help support that. And then lastly would be the immune function. It is strongly influenced by our microbiome. We know that these short-chain fatty acids have an effect on our immune cells, but moreover, these bacteria, they can help to upregulate or downregulate immune expression. So we can see better or worse response to pathogens in different responses by the immune system. And that could be either promoting something called intestinal permeability or preventing, really depending on which species of bacteria might be at play, preventing or promoting that intestinal permeability. And we see in patients, because we're measuring gut pathogens, we're measuring LPS, we're measuring gut barrier function, as well as food sensitivities, all these different markers that can give us a better insight into how the gut is responding and what the balance of these microbes are. We do use stool testing quite a bit for patients, whether they're having GI symptoms or perhaps joint pain, maybe there's some skin rash like eczema or psoriasis. All of these symptoms sometimes will point to what we call dysbiosis in the gut, but we also know that stool testing is kind of a snapshot in time because thankfully the microbes react pretty quickly to changes in the environment, whether that's stress or food or medications. All of these things affect how well or poorly these bacteria are going to respond to the environment. So let's talk a little bit more about that dysbiosis idea. When we have an imbalance of bacteria in the gut, we can see this through some of the gut stool testing that we do, But what causes concern for us when there is dysbiosis present is its effect on the immune system. And as I mentioned earlier about the intestinal permeability, this is a problem for patients when we detect that that might be present, because the lining of the intestinal tract has been compromised. And things within the intestinal tract, food, specific food proteins, it could be medications, it could also be just different bacteria or yeast or fungi that begin to migrate through in between those cells into the bloodstream. And if you think about normal immune function, we have macrophages that are there at the ready, immune cells, to find these pathogens. They're on surveillance. So they see these bacteria, different food proteins that have come into the bloodstream, and they start to mount an immune response. And so then we see antibodies being created against foods that you're normally eating, like avocado and blueberries and carrots and corn tortillas, maybe, things that are in your diet on the regular, because they're migrating through, your immune system recognizes it and starts to make antibodies against it. So that would be a high immune response. We would want to repair that lining in the intestinal tract, or perhaps even do what we can to avoid that happening in the first place. And we'll talk about some of those things that we can do to prevent it. But anytime that we can calm the immune response down, recruit the good bacteria, what we call commensal bacteria, to help respond in a positive way with immune function, then we have better outcomes. A few of the other related things to dysbiosis and an immune response in the gut are a few common comorbidities like type 2 diabetes. We might wonder, why would someone have type 2 diabetes if they have dysbiosis in the gut? We don't really know the answer to that, but we do know, we have seen some correlations in studies that intestinal permeability could be at play. We also know one of the metabolic effects that the gut bacteria have on the environment is the production of GLP-1. And most of you have heard about GLP-1 peptides as the name brand weight loss medications, Ozempic, Mounjaro, and Zepbound, Wegovy. Some of those are some of the names that you're probably familiar with. But we produce GLP-1 in the body, and these gut bacteria and the short-chain fatty acids are part of that production within the intestinal tract. Now, the difference is the half-life within our system from normal production is somewhere between 1 to 2 minutes, but the medication is days long. So one of the things that researchers are really looking at is, how do we increase our own GLP-1 production in the gut by manipulating the bacteria, by being sure we're eating enough fiber to produce these short-chain fatty acids, maybe taking in probiotics that are specific to helping us produce that. It's a really exciting area of research, and I'm looking forward to learning more about it and sharing it with you too. We also have seen the gut microbiota being involved in inflammatory bowel disease, another form of an immune disorder where we have Crohn's disease or ulcerative colitis. Those two inflammatory conditions have been related to low diversity of microbes within the gut. And so finding ways to increase that diversity and make that a more well-rounded ecology are strategies that we use to improve outcomes for patients with IBD. We also have seen correlations to low diversity in the gut to lupus, systemic lupus. So really trying to see how are ways that we can manipulate the diversity the particular strains and species of bacteria within the gut to help prevent these diseases, or in the case of patients that have already been diagnosed with these inflammatory conditions, that we can prevent and reduce the flares, because oftentimes these flares are very debilitating. They really do affect quality of life for patients. So you may be wondering, what are factors that are going to disrupt this wonderful, magical microbiome that we have in the gut? Well, we'll talk about a few of those. It could be medications, so particularly things like laxatives. If I have a patient that has constipation and is on a continuous laxative, that is something that could affect the microbiome. We would want to look at ways that we could work on improving that. Also, patients that might be taking PPIs or proton pump inhibitors, if you suffer from reflux or some kind of heartburn, then those medications can also cause a change in the microbiome and how strong they may be, or what the diversity of our bugs might be. So looking at your medications would also be one thing that we would want to consider. Second would be looking at antibiotic use. We know that most of the antibiotics that we use really don't quite discriminate about which microbes it's killing. Some are broad spectrum, and so we want to be careful about antibiotics. A wonderful invention and important for our long-term health and needed in certain situations, but we also want to be cautious about their overuse because it can affect the ecology of the gut. We also know that pesticides and herbicides in our food have been correlated to lower diversity of microbes in the gut. So this is where maybe taking a few minutes and going to the Environmental Working Group website. They have a great list of organic vegetables that you should buy. You might have heard about the Dirty Dozen list. These are a list of 12 foods, produce, fruits and vegetables, that have been tested for pesticides and herbicides. And these are the 12 that have shown to have the highest amount of chemical residue that's not so beneficial for us. And so if you can buy those 12 foods organic, that's going to be best. They also have a list called the Clean 15 that is going to be a list of foods that have lower residue of pesticides. And so if you can't buy them all organic, these 15 are okay to buy conventional. So we want to look at our pesticides and herbicides. The other thing that could affect our microbiome is your method of birth, which we've already talked about, vaginal birth compared to C-section. And then we have stress, which none of you have stress, I can imagine, right? I know I have probably enough stress for you and me both. But I think that if we can manage our stress, that's going to be a really important way to help the vibrancy of our gut microbiome. Within the gut, you know, when we talked about earlier, you know, the brain and the gut at development, they're coming from that same cell. The gut has more neurons in it than the central spinal column. That whole brain, from the brainstem down through the gut, there are more nerve fibers there. And we know that the gut sends more messages up than the brain sends messages down. It's kind of like you have one of those friends that does all the talking. That's your gut. Your gut is going to send all these messages, collecting so much information from your environment and sending it to the brain. And those things are important, but what we're learning is that the bacteria are also perhaps traveling and sending messages up the vagus nerve to the brain. So when we think about managing stress, if we're collecting all this information from the environment, maybe involving some practices that are grounding, that are involving breath work, that even practicing mindful eating, where you're looking at your plate and taking a pause and thinking about the gratitude that you have for the food that you're eating, all the hands that touched the food before it came to you, from planting to harvesting to purchasing. That's a lot of people. There's a lot to be grateful for. So taking a few minutes to really think about your food, that can bring us a sense of calm, take us out of that fight or flight into the rest and digest, which is where we want to be when we're eating our meals. So managing stress is a really important thing to do to help our gut microbiome. And then the other thing that you probably don't think about is hygiene. We really want to be able to get dirty enough. We're in an environment where we're so sanitized and sterilized. When we get outside and get our hands in the dirt and walk barefooted, we're actually exposed to bacteria in our environment, and those things can actually be good. It's good not only to help reseed our own environment, but if we're not training our immune system to respond to other pathogens, it's not going to have as strong of an immune reaction if we stayed so sanitized and sterilized. So what are the good things that we can do besides avoiding those things? We also want to talk about what you can do to have a happier, healthier gut. So besides just avoiding those things, my number one thing, and it will sound boring to you, but it's more fiber. Fiber, fiber, fiber. It is what feeds these microbes. They're what people may talk to you about as the prebiotic. So some formulas of probiotics include a prebiotic with it. All that is the fiber that's going to feed that organism. And these can be delicious things in your diet, like oats and raspberries and blueberries and strawberries and black beans and chickpeas and lentils and quinoa, and I could go on and on. There are so many delicious sources of fiber that you can enjoy that are going to make those bugs really happy. And they're kind of like us. We like different things. You like different foods, I like different foods, and our microbiome likes different foods too. So having a diversity of those foods, different fibers, and different colors, because the colors in the food are what we call polyphenols, and those also feed the microbiome. We know that that has an effect on the health of those microbes. Getting probiotics in the form of fermented foods or in cultured dairy, beet kvass, kombucha. These are all also really yummy ways to get these microbes in. And you don't really need a lot of it. A few ounces of kombucha or beet kvass, a tablespoon or two of fermented vegetables like sauerkraut or kimchi, kefir as a drink. So there's a lot of different ways that we can ingest these foods, make them part of our meals, and at the same time really enrich our health. So getting outside, like I said, putting your hands in the dirt, your feet on the ground, exposing to some of those microbes, all of these are ways that are going to help us build a happier, healthier gut microbiome. So I know there's a lot of information here today. I do hope that what I've shared is something that you feel is actionable and you can get out and start some of those practices to keep your gut health going. If you need help, let us know. I'm here. I'd love to talk to you about your concerns or your questions. Please come see us at Sydenham Clinic, and until then, be healthy.